So what is family counseling? Family counseling consists of a family and a counseling session.
So what is a family? According to the U.S. Census Bureau, a family consists of two or more people, one of whom is the householder, related by birth, marriage, or adoption and residing in the same housing unit. A household consists of all people who occupy a housing unit regardless of relationship. A household may consist of a person living alone or multiple unrelated individuals or families living together. According to the traditional family, it is a group that consists of a father, a mother and children living together in a household. And what is counseling? According to the British Association for Counselling, BAC, counselling is the skilled and principled use of relationship to facilitate self-knowledge, emotional acceptance and growth and the optimal development of personal resources. The overall aim is to provide an opportunity to work towards living more satisfyingly and resourcefully. Counseling relationships will vary according to need but may be concerned with developmental issues, addressing and resolving specific problems, making decisions, coping with crisis, developing personal insights and knowledge, working through feelings of inner conflict or improving relationships with others. And family counseling means. From the Mayo Clinic, it is defined as a family therapy, which is a type of psychological counseling, psychotherapy, that helps family members improve communication and resolve conflicts. And from the family means, family counseling brings together members of a family to work through situation or relationship issues. Concerns may include changes in family relationships, conflict, health issues, addiction or other. Counselors will help the family recognize their patterns, build on the positive and develop alternatives, providing all family members a voice in the process. And from the Commonwealth of Australia Consolidated Acts, Family Law Act 1975, Sec 10b, family counselling is a process in which a family counsellor helps a. One or more persons to deal with personal and interpersonal issues in relation to marriage, or b. One or more persons, including children, who are affected, or likely to be affected, by separation or divorce to deal with either or both of the following. I. Personal and interpersonal issues. 2. Issues relating to the care of children. Now before you start counseling, you need to have the client's profile. Usually in a client's profile, like in this client's case, this client is a female, age 23 years old, she's a Malay and a Muslim, she is from Terengganu, she is taking a degree in fine art, currently in her third year and she is the last child of 9 siblings. Due to confidentiality reason, the name of the client is hidden and it is approved by the client to use her case in the assignment for educational purpose. Her case details were as follows. I'm having communication issue with my family, especially with my brothers and sisters. I feel that since I study in Animus, my family did not care much about me, they rarely ask about me. I used to be closes with my mother and one of my brother, but lately not anymore since they rarely contact. I feel left out when my family members having conversation, WhatsApp, because they always talk about marriage. I have become a quiet person when with family, unlike when I'm with my friends. One of the theories that are suitable for this issue is the narrative therapy. The founders of narrative therapy are Michael White and David Epstein in 1990. This therapy is based on social constructionist perspectives and postmodern therapy. Narrative therapy is a method of therapy that separates the person from the problem. It encourages people to rely on their own skill sets to reduce the problems occurring in their lives. It helps client to have power to reauthor their lives and develop alternative life stories. The followings are the techniques and skills applied under this therapy. First is the therapeutical conversations. One must externalize the problems first. For example, I have communication issue with my family.
What is the communication issue in your family?
Or, I feel that my family members does not care about me.
What is the situation in which you feel you are not being cared about?
Next is try employing therapeutic questions. For example, I have communication issue with my family.
What is the issue in communication that you are having? How does communication issue affecting your life?
I feel that I'm being left out by my own family members.
What is situations when you feel that you are being left out? How does being left out affecting your behavior in the family?
You can also try to seek unique outcome, such as, my mother rarely contact me since she helps my sister after giving birth.
You said that your mother rarely contact you, but is she still in contact with you?
Yes, she does, at least once a week. At this point, you can use it as a unique outcome. Or, my siblings keep on talking about marriage life, I cannot join them because I'm not married yet.
If you join in their conversations, does they give you any reply?
Yes, they do. This is still a unique outcome. Next is try to co-constructing alternative stories by storytelling, therapeutic ceremonies, letters and leagues. The first step in therapeutic ceremonies is that the client will sit at the center of the group and surrounded by outside witnesses or observers. She will tell her problematic and alternative story to the group. The problematic story is that she have communication issue in the family while the outside witnesses are anonymous students that study away from their families. The second step is after the client at the center finishes her stories. The first outside witness will retell the story by the client, but the retelling story will be based on the outside witness point of view and experience. Third step, after the first outside witness retells the story, the second outside witness will retell the story from the first outside witness based on their own point of view and experience. Fourth step, until the end, the retelling of stories will continue until the last outside witness retelling the story based on his or her own point of view and experience. Next is the therapeutic letters. Example of therapeutic letters are summary letters which are given by the therapist to the client. Summary letters contain the notes or comments on the discussion between the therapist and the client. Recalled of client's words and reminder of some unique outcomes can also be included. It can open up the possible alternatives for the client's story for the following session. Lastly is forming supportive leagues. Supportive league that can be formed for this issue is supportive league which consist of anonymous students that study away from their families and having communication issue in their family too. The group learning experience is to gain knowledge and experience in handling family counseling and on how to apply family therapy theories in counseling session. To experience and practice the application of family therapy and techniques in conducting counseling session. To broaden the awareness and insight on the importance of family counseling in society. To be able to find own strengths and weaknesses in conducting family counseling and to find ways to improve them. Reflection on self's feelings. The counselor feels anxious, uncomfortable, lack of confidence and incompetence since she is still new in handling family counseling using theory from family therapy. The counselor feels empathy towards the client because the counselor also studies away from her family. Reflection on the contents. Counselor is lack of knowledge and skills in handling family counseling. The session will be more effective if the counselor has more experience and knowledge about family counseling. Productive counseling session can be conducted if all family members attend the family counseling.
Here are more information on the techniques and skills in narrative therapy.